Hi YouTube, this is Dan Siegel with Hope for Zion. I honestly do believe that we are in a situation where we're going to be needing all of the things that we are trying to prepare. I'm hoping that these videos help you and bring some things to mind that might help you to prepare. And I've tried to break them down into parts so that I'm not dumping the whole load on you all at once, and you can go back and review these videos one at a time, and that you will remember things that you might want to keep your eyes out for, or you can work on one segment at a time and get prepared for what's about to come. In all of my videos, I start out letting you know that I prepare in 4 parts. My physical preparation, my spiritual preparation, the skills that I acquire, the skills that I'm able to offer a group, and the people that you gather with or that you gather around you. And again, the rule of threes and the rule of musts. There are rules to preparation. 3 minutes to bleed out if you don't have a tourniquet. 3 minutes without air. 3 weeks without food. 3 hours in harsh conditions without shelter. 3 cutting tools. 3 firearms or means of protection. 3 miles to walk and then you rest. 3 hours of walking and then change your socks if you can. 3 methods of fire starters. 3 methods of water purification, and 3 days supply of concentrated food. Again, the rule of must. You must have water, you must have fire, and you must have food. Learn multiple skills about acquiring these 3 musts: water, fire, and food. Become the most valuable member of your group or family by the skills that you have. Learn and live the beliefs that 1 is none and 2 is 1. Loose lips sink ships. Improvise, adapt, overcome. Be flexible. Things seldom go as planned. The rules change when the SHTF. Today, in the 17 C's of preparation, we're going to be talking about number 12, care, medical care. Your medical preparations. Get a medical kit, a trauma kit, extra glasses and sunglasses, soap, bars preferably, towels and washcloths, and rehydrating towels. You can buy those at different places. Any camping supply usually has a rehydrating towel that you can get. Insect repellent is going to become critical. Vaseline, cotton balls, band-aids, toilet paper, feminine hygiene napkins, rubber surgical gloves, prescription meds, anti-diarrhea medication, lip balm or bag balm, over-the-counter pain meds, antacid baking soda, elastic bandage wraps, triple antibiotic ointment or antiseptic cream, gas mask, Q-tips, iodine or honey, dental picks and baby wipes or Ziploc bags. First, a medical kit. You can put your own together, or you can buy a medical kit, a first aid kit that has band-aids and a few things in it that you're going to need. Have a medical kit, a trauma kit. Not all trauma kits are created equal. You can buy them or you can make your own. Get one and look at it carefully and make sure that you have all the parts if you're going to make your own. Sunglasses, extra glasses. If you wear prescription glasses, make sure that you have an extra pair. Sunglasses in the event of hot sun or high light, you're going to want to protect your eyes. Soap for taking care of washing. I can't stress the need that you're going to be under to maintain sanitation. Some of the worst deaths and the highest number of deaths occurred during the Civil War when people didn't have proper sanitation. Dysentery and cholera actually claim more lives than gunshot wounds. Towels and washcloths, baby wipes, rehydrating towels, save those after you use them. They become toilet paper. You can use them twice, especially if you're just drying your hands or you're just toweling off your face. Washcloths, the same with these baby wipes. When you use a baby wipe, if it's not completely soiled, save it, and you can use it for toilet paper, you can use it for other things. Make sure that you think about everything that you're going to have and dual purposes that you might be able to use everything for. Insect repellent. Insect repellent will become critical. I know that when we were in Iraq, they would issue insect repellent to us, and we would put dog collars around the bottom of our bunks to keep the insects from crawling up the legs of the beds. Vaseline, cotton balls. This is just what it says on the outside. It's petroleum jelly. You can not only treat cuts and wounds with this, but you can also use this to start a fire. You put a little bit on a cotton ball, toilet paper. This goes without saying. This is critical. There are a few things that are critical, and a way to clean yourself will become critical. Feminine hygiene napkins. These can be used for many things. They can be used for stopping large wounds. They can be used for bandages. They can be used for starting fire. They can be used for many things. Even if you don't need feminine hygiene napkins for the purpose for which they've been made, buy some for, if no other reason, to take care of wounds. Surgical rubber gloves. Make sure that you get a supply. It's going to become critical. Prescription meds. If you're on meds, medications of any kind, make sure that you put in a supply so that you have your medications. Don't rely on the fact that the pharmacies are going to be open. Those people are going to be going home to take care of their families too. Make sure that you take care of yourself while you can. Anti-diarrhea medication. Have some anti-diarrheal medications on hand. Bag balm. There are a few things that are better to have than something to put on your lips or something to use on cracked hands than lip balm or bag balm. Over-the-counter meds, Advil, Bufferin, Excedrin, aspirin, cold medicines, anything that you can buy over the counter now. You think, oh, I don't need those right now. You don't need them right now, but they may become critical to your comfort and survival in an SHTF situation. Get them now while you can. Antacids or baking soda. And don't forget your dollar stores. You can get your over-the-counter meds for maybe a little bit less than you can at a regular drugstore. Be looking at these places to get some of these items. Elastic bandage wraps in the event of sprains. If you turn your ankle or you need to keep a wrap in place or you need to keep a bandage in place, these work very well. Make sure that you have some. Triple antibiotic ointment or antiseptic cream. A scratch can become infected. Have a way to treat it. Make sure that you can keep it clean. The antiseptic wipes you may think are overkill. The baby wipes to clean up small wounds, scratches, things like poison ivy. If you happen to run into that, or thistle, make sure that you have a way of taking care of some of these things. A gas mask. Q-tips. Q-tips are critical. You can use these to start fires. You can put some petroleum jelly on them. They become flammable, and they will burn in the event that you don't have anything else. Also, the Q-tips are good for cleaning iodine and honey. Now, I used the iodine and the honey in the same frame because honey is more than a sweetener. It can be put on a wound, and it is an antiseptic that will actually draw infection. Iodine, you want to have a supply of iodine. If you go to your tack shops, if you go to your farm and ranch stores, you can find iodine for use on animals, and it's the same iodine that you would use on yourself, and it probably costs quite a bit less. Dental picks. Dental picks for not just taking care of your teeth. Baby wipes again, and the Ziploc bags. Okay, YouTube, that is my suggestions for your medical care. Thank you for watching part 12. I will see you at part 13. And thanks again for watching this preparedness series on the 17 C's of preparation. Remember to subscribe, and I hope to see you back at part 13.